So anything above 7.4, alkalosis, anything below 7.4, acidotic. CO2 is your main acid issue, but low bicarb can be an acid issue. So there are two things that will cause you to be acidic. Having too much CO2 in your blood, or having too little bicarb in your blood. What will make you alkalotic? Not having enough CO2 in your blood, or not having enough acids in your blood, or having too much bicarb in your blood. Okay, so we will keep talking about that. Signs and symptoms of acidosis. Oh, Lord have mercy. Everybody wants to memorize these lines, signs and symptoms. Well, if you want to think about acidosis, think about a time that you worked out really hard. So you overdid it at the gym, or ran a marathon, or you did something. How do you feel the next day? Sore, crappy, maybe a little bit sick. Or if you've had a really good massage, if you've ever been sick after a really good massage where they work out a lot of knots, and you got a lot of toxins in your system and you feel kind of crappy, that's what acidosis feels like. You just feel crappy. You have toxins in your system, acidic toxins that your body doesn't like. And so you're going to feel nauseous, vomiting. There are acidic things in your body that it doesn't want. So what's it going to do? It's going to try to get rid of them. So you're going to get nauseous. You're going to vomit. You're going to have diarrhea. You're going to feel cruddy. You're going to be achy. You're going to be sore. You're going to be headachy. You're going to be confused. And you're going to be short of breath. Why would you be short of breath? What are you trying to do? You're acidotic in your blood. What are you going to try and do? You're going to try and get rid of CO2. You're going to be breathing kind of heavy, kind of fast, trying to blow off a lot of CO2. It's going to make you feel a little bit short of breath because your lungs are trying to get rid of this stuff. We're going to sweat out this stuff. We're going to feel cruddy, okay? Being acidotic just makes you feel really cruddy. Just think about working out way too much, and you're going to feel headachy and kind of sicky and sore the next day. All right? If you've never done that, congratulations. You're taking very good care of yourself. But acidosis feels kind of crappy. So let's talk. We will do the ABGs, but what I want you to know is what's going on in your body. Why do we care what these ABGs are? Well, we need to figure out what the problem is and try to fix it, right? That's our goal with patients, is try to fix them. What's the point of getting numbers if we don't do anything about them? So when you have a respiratory acidosis, that you have, your body is acidic because of a respiratory reason, where do you think the problem is from? You have a respiratory problem from your lungs. What are you not getting rid of? CO2. So your lungs are not doing a good job of getting rid of CO2. If your ABG comes out reading respiratory acidosis, the reason is your lungs are not getting rid of CO2. The problem and the culprit is lungs. It's in the name, respiratory acidosis. So that it gives you your cause right there. When we read the ABGs, it tells us what the cause is. A respiratory acidosis is you're not getting rid of CO2, which is hypoventilation. Whether it's because you can't get air in and out or because you're not breathing strong enough, you're not removing CO2, all right? CO2 is not leaving the body, causing a respiratory acidosis. So there are a number of things, and this is not the only list. It's the most common. COPD, which you will learn about next week, is an obstructive respiratory disease. You can't get air out. So what's going to happen? You can't get air out. You can't squeeze it out. Your airways are all full of junk, and you can't get air out. You don't exhale. So what are you holding on to? CO2. The only job of the exhale is to get rid of CO2. If you can't exhale, you don't get rid of CO2. So where does the CO2 hang out? In the bloodstream. If it doesn't get out, it stays in the bloodstream, and we start having higher and higher CO2 levels. If you take narcotics or a sedative and you don't breathe deeply, you're only breathing 8 times a minute. You may be exhaling great, but you're not exhaling enough to get rid of all that CO2 that we build up. So sedatives or narcotics will make us retain CO2 because we just can't, we're not breathing enough. We need to breathe 12 times a minute to exhale a normal amount of CO2. If we don't breathe 12 times a minute, we don't exhale enough CO2. Or if we're taking teeny tiny little shallow breaths that don't exhale well. So problems in exhalation will give you respiratory acidosis. Any problem with exhalation will give you respiratory acidosis. So why would pneumonia and atelectasis, what is atelectasis? You might not have heard that. Collapsed lungs. So why would pneumonia, junk in your lungs, or collapsed lungs cause problems with your CO2?
Does that allow you to get that expelled air properly?
Well, it's not a mechanical problem. You can expel air. There just isn't exchange going on in your lungs. Oxygen and CO2 exchange at the alveoli. If the alveoli are crudted up, the exchange can't happen. Oxygen can't get in, CO2 can't get out. The exchange happens at the alveoli. So when your alveoli are crap, CO2 stays in, oxygen doesn't get in. So you end up building up CO2 and not getting enough oxygen. Causes a problem. But the culprit is respiratory, so your interventions are going to be respiratory for these people. Then there's this compensation piece. The culprit is respiratory. Well, we got backup systems. The body's an amazing object, and we have backup systems. So we're building up CO2 in our bloodstream because whatever's happening up here isn't working out very well. So we're building up CO2. We can't have this, right? Our body's like, no, this is no good. No bueno, my pH is going up. No bueno, alarm, alarm. What are we going to do? Well, there's a backup system. The kidneys are like, I got you. We'll get rid of it. What are they going to get rid of? Now, the CO2s don't pee out the kidneys don't pee out CO2. They're going to pee out other acids. So what are they going to pee out? What are acidic ions? Well, yeah, we're going to get rid of our waste products, but we also get rid of electrolytes and hydrogen ions. We get rid of some other acidic things, but we also now hold on to bicarb. Why would the kidneys hold on to bicarb? To neutralize those CO2s. We are going to we're like, whoa, we may have wanted to pee out those bicarbs. We got this high pH going on here, so come here, bicarbs, we need you. And the bicarbs will latch onto those CO2s and turn them into water, which will then pee out. So the kidneys have got you, okay? They're going to pee out some extra acids, maybe find some more waste that we wouldn't normally get rid of and just pee them out. It's going to pee out as many acids as it can find, and it's going to hold on to CO2. So what do you think our CO2 blood level is going to do? It's going to go up. It's going to go up, or it's going to stay the same. But the kidneys are trying to fix the problem. Now, when kidneys recognize a problem and kick in, it takes a couple hours for kidneys to kick in. I don't know why it's doing this. It keeps giving me like this little... Go away. So, respiratory. The problem is respiratory. The kidneys kick in later to try and help deal with it, but the problem is respiratory and will not go away until you fix the respiratory problem. Okay? So there's a little bit of that. We'll show you how it works with the ABGs. So here's what it looks like on your actual ABG. So look at all that CO2 just hanging out in the lungs, not leaving. High amounts of CO2 in the lungs and in the blood. Okay? So when you take your blood sample, what are you going to get? What is your pH going to read? You are in respiratory acidosis. Your pH is going to be low. It's going to be below 7.4. And what is your CO2 level? It's going to be high. What do you think your bicarb level is going to be?
Uncompensated.
Well, it depends on whether the kidneys recognize it or not. The givens will be that your pH is going to be low, your CO2 is going to be high. The bicarb, it depends on whether the kidneys recognize it or not. So we'll talk about compensation. Now, we're going to talk about it again next block, and I will refocus on compensation. For this block, I want you to get down what the culprit is. The compensation piece, I don't really care so much about that. We'll review that next block. I don't care if you don't get compensation right now. You will have to get it next time. So if you get it now, it's great. Make it easier for you in block 3. But I want you to really be able to get the culprit. to look at an ABG and know what the culprit is. And if you know what the culprit is, it's respiratory. You've got to fix something respiratory. What are we going to do? Respiratory stuff. If you have a respiratory acidosis, you better make sure that your lungs are open, that you have an open airway, that you are monitoring your respiratory rate, that you are listening to breath sounds. Why are they not exhaling properly? Why are they not getting rid of CO2? What is going on? We've got to fix it. So this is where we can do respiratory things. We can sit them up. We can get them breathing better. If they're all crouched down in the bed like this, maybe sitting them up and expanding things will help this exhalation process. Give them O2 if you need to, but O2 only matters if their O2 is low. If you are not exhaling, you may need O2, you may not. That's not dependent on your respiratory acidosis, but you have respiratory interventions. I want you sitting them up, coughing, deep breathing, suctioning. A lot of times people will end up in respiratory acidosis because they have so many secretions they can't get rid of. So the secretions block the exhale and they start building up CO2. Sometimes maybe they're weak. Maybe their respiratory muscles are weak and they can't breathe in and exhale. Then we'll have to do something about that. Or is it their electrolytes? I don't know. We've got to fix the respiratory problem to fix the respiratory acidosis. So all respiratory interventions, sit them up, give them O2, suction them, do whatever you can do to get them exhaling better. A breathing treatment may help respiratory acidosis. If they're wheezy when you listen to them and they can't exhale because their airways are shut, a breathing treatment will help respiratory acidosis. So you need to figure out, you focus, laser focus. You have an ABG that says respiratory acidosis, you laser focus on that respiratory system and figure out what's going on. And that's your interventions for respiratory acidosis. It is a respiratory problem. It is not enough exhalation going on for whatever reason. You're going to get to that and figure it out. Look at your patient, figure it out, and fix it, and that will fix your respiratory acidosis. So let's talk about a metabolic acidosis. So, what is your pH? Low. pH is low, it's acidosis. pH is going to be low. The problem is not retaining CO2. The problem is what? Bicarb. Somewhere, somehow, you lost bicarb. Did you lose bicarb because you pooped it all out? Did you lose bicarb because the kidneys can't hold on to it and it's just all disappearing? Did we accumulate more acids than the bicarb can buffer? So metabolically, there's two reasons you're acidotic. You either lost all your bicarb or you got more acids than bicarb can handle. Either way, what's your bicarb level going to be? Is your bicarb low or high? Low. Your pH is low and your bicarb will be low. All right? These metabolic problems, diabetic ketoacidosis, lactic acidosis, renal disease, mean that we're holding on to acids for whatever reason. Lactates is an acid. So when we work out really hard, we actually, and people who are on a high keto diet, are actually putting themselves into a level of acidosis. These are acidic byproducts. The body doesn't like them. And so we do something to get rid of them. They will make you acidic, so you use up all your bicarb buffering them out because we have them for whatever reason. So what do you think the lungs are going to do in this situation? You've got a lot of acidity in your body. So what are you going to do? You are going to blow out extra CO2. You've got to get rid of some acids. You don't care which one. You can't get rid of lactate out of your lungs. But you can get rid of some ketones out of your lungs. You can get rid of some of these things out of your lungs, but you're going to get rid of CO2. So how do you think you're going to breathe? You need a big exhale because that's going to blow out CO2. So you're going to go... Yes?
So is that essentially just a control breathing?
Yes. Small breathing. Oh my God, what did I do when I just did that to myself? I made myself lightheaded. Do it. You'll make yourself lightheaded. All right, because I blew off all my CO2. Yes, that is Kussmaul's respirations. Are those big, heavy breaths. And you will see it anytime you're in metabolic acidosis. Your kidney failure patients may be Kussmaul breathing. Sometimes we call it guppy breathing because it looks like all they're doing is trying to blow off CO2. There's nothing wrong with their lungs. Their lungs are actually doing what they're supposed to be doing. They're getting rid of acids. CO2 plus. I didn't have extra acids, so then when I blew them off, I got a little woozy. But your lungs can compensate, okay? Because they want to get rid of acids. So your ABG will look like your bicarb is low. That's your diagnosis right there. Your pH is low, so you know you have acidosis. Then you have to look and see which one matches that acidosis to figure out what the cause is. This one is metabolic if your bicarb is low. If your bicarb is low, it is metabolically acidotic. And then compensation is whether your lungs are trying to do something about it or not. Okay, what will your lungs do to compensate? What will your lungs be trying to blow off? CO2. So if your lungs are trying to blow off CO2, your CO2 level will drop. You will keep working on this until it makes sense. Metabolic acidosis feels exactly like what you do when you hyperventilate. You can hyperventilate anxious-wise. That becomes a respiratory thing. But it feels like, metabolic acidosis. Never mind. I'm moving into alkalosis. Oh, I'm getting confused. Acidosis feels like acidosis. Okay? Metabolic acidosis feels like respiratory acidosis. You feel cruddy. You feel sick. You feel headachy, sore. You may have Kussmaul respirations. That's compensation. But remember, we had diffuse confusion, drowsiness. We had all that in in respiratory acidosis, right? We had confusion. We had achy. These signs and symptoms, hyperkalemia, muscle twitching, warm flush skin, all go along with whatever is the metabolic problem. It could change. I don't like this slide. I don't want you to remember signs and symptoms of metabolic acidosis. The biggest one you're going to see is the Kussmaul, because that's our first sign and symptom. There aren't a whole lot of signs and symptoms that are specific to metabolic acidosis. What you're going to see are the signs and symptoms of whatever disease is causing your metabolic acidosis. If you're in diabetic ketoacidosis, you're going to see the Kussmaul's respirations. If you're in renal failure, you're going to see the signs and symptoms of renal failure. If you've got rid of diarrhea, you're going to see the diarrhea. It's going to be the cause of your metabolic acidosis are your signs and symptoms of the metabolic acidosis. So you're going to know there's a problem because there's some kind of disease going on. The culprit is something happening in your body. So whatever is messing up in your body is what your signs and symptoms are, okay? We try to make this a lot harder than it is and memorize slides we don't need to memorize. Respiratory problem is your lungs are not breathing well. Something's not breathing sufficiently. Metabolic, there's something going on in your body, some kind of disease process or something causing you to be acidotic. You're going to have to look a little deeper. This one's not as easy and doesn't have straight signs and symptoms. You feel like crap because you're sick. Are you sick because you got diabetes? Are you sick because you've got massive dehydration and volume loss and diarrhea? Do you have C. diff? Something's making you sick. You got to figure out what's making you sick. You won't fix the metabolic problem until you figure out what's making it sick. So the first problem is assist with identification of treatment of underlying causes. There are a million things that can make you sick. And most of them are diabetes and renal. But you can keep an eye on your blood pressure, of course. Keep an eye on your mental status. Both acidosis, metabolic and respiratory, make you feel confused and lethargic and weak. And you're just going to have to do a lot more workup with metabolic. There isn't a lot you can do other than be like, yep, not a respiratory problem. All right, well, then we need to look into the bottom of it. What's going on? I wish I could give you a black and white list of what makes metabolic acidosis. But what you're gonna see is as we go through in block 3 and 4, through all the diseases, there is almost anything can make you metabolic acidosis, okay? The important part is that you can recognize it and know that you've got to get to the bottom of the cases for metabolic acidosis. So you're gonna be doing a lot of monitoring and vital signs and watching. So let's talk about alkalosis. So metabolic acidosis is from a disease process. Respiratory acidosis is from not exhaling enough. Let's talk about alkalosis. You want to take a break? No? I'm going to give you alkalosis and then we'll take a break before we actually start ABGs. So, alkalosis, the symptoms of alkalosis is basically what you feel when you hyperventilate. Alkalosis means that you are in a alkalotic environment. You're not acidic. You've lost acids somewhere. What does that feel like? It feels confused and lightheaded. Exhale out all your CO2, hyperventilate or deep breathe, small breathe, and you will feel alkalotic. It mostly feels confused, lightheaded. You can get some tremors. You get numbness and tingling of your lips and face. Anything that gets rid of your acids will make you feel this way. Let's talk about respiratory. Why do we get respiratory alkalosis? What have we gotten rid of? So, alkalosis, where's our pH? High. If our pH is high, what have we done? We've either gotten rid of too much acid respiratory-wise, we've gotten too much acid gone metabolically. So we don't have enough acid. If it's a respiratory cause, how did we get rid of all that CO2? We breathed too much. We either blew it all off with those big, deep breaths, or we hyperventilated. You panicked. You can blow off all your CO2. Well, there's all the reason you can blow off CO2. Hypoxia. You don't have enough O's. So what are you doing? You're huffing for air. And you end up blowing off a lot of CO2 with it. Pain. You're breathing fast and shallow. You blow off a lot of CO2. Anxiety. Fear. Pulmonary embolus. What the heck's going on with pulmonary embolus?
Blocking.
Well, you're going to do that when you do respiratory. But what's happening is the oxygen is getting blocked from exchanging. So you can exhale it, but you don't actually take anything in. It's a mess up of the thing. Just know that pulmonary embolus can cause respiratory alkalosis. It can cause acidosis too, honestly, but you can put it there if you want. But most of the causes of respiratory alkalosis are going to be hyperventilation. Hyperventilation. Why? Sepsis is because when you are having a bloodstream infection, you end up exhaling a lot because sepsis makes you acidotic. So you end up blowing off a lot of CO2. Brain injury, because your brain is not breathing appropriately, you blow off a lot of CO2. Again, if you're blowing off too much acid, what are your kidneys going to do? They're like, dude, come on. What are you doing to me? What are they going to hold on to? What are they going to hold on to? You blew off all your acid. They're going to hold on to ions, acids, and they're going to get rid of bicarb. You got rid of all your acids. You don't have any acids in your body. You're getting too soapy, alkalotic. Your body can't live in that environment either. It needs some acids. So it's like, all right, fine, I'll hold on to some. I won't excrete them. Fine, I won't excrete them, and I'll get rid of bicarb instead. Hopefully you don't stay in this. Most people don't stay in respiratory alkalosis that long because the kidney kicks in and holds on to stuff. But here you don't have any CO2s left in your lungs. You blew them all off. Your CO2 level is low, and your pH is high. Your respiratory alkalosis. If your kidney is compensated, what's going to happen to your bicarb level? So you don't have any acids left in your lungs. You blew them all off. So what are your CO2? They're going to hold on to hydrogen ions, and they're going to excrete bicarb. So what happens to your bicarb level?
Decreases.
It will decrease. Okay. That's if your kidney is compensating or not. Don't worry. We will keep... Did I mess it up?
One says
I think I might have messed it up. Let's see. I think it's flipped. So compensated means that the kidney, the H bicarb will be low. So you did catch that. So in compensated, your bicarb level will be low, and in uncompensated, your bicarb level will be normal because it hasn't caught anything. So let me just fix that right now. What I'm going to do is upload, if I make changes to the slides, I'll upload the new slides. So this is bicarb normal. Bottom one's and this one's bicarb low. Okay. So fix that on your slides. I'll upload the new slides afterwards. I don't know why it's uploading. Okay. So here's just, signs and symptoms again. I would remember, if I could remember any symptoms, it would be lethargy, confusion, lightheadedness, numbness, and tingling. All the rest of them could be variation. Because really, all you have to do, sit on a test. I've watched people do it at the test. They're like, if the culprit is respiratory, you blew off too much acid, what are we going to do? Calm down. Stop. What are you doing? What are you doing? What is the respiratory rate? Is it shallow? Is it deep? What are you doing? There's a respiratory problem. What are you doing? Let's see if we can calm things down. Relaxation, reduce stress, sedation, pain medicine. If they are blowing off too much O2, we can have them breathe into a paper bag. That's why you have them breathe into a paper bag. Because what are they going to do when they inhale? They're going to inhale back their CO2. They blew out too much. So that's why you give people a paper bag when they're hyperventilating. Because basically you're making them rebreathe their CO2. One of the things that does it is those masks. Because you're putting them into a mask and then you're huffing back in the CO2 that doesn't get to escape. Only because you put a mask on them. And to be considered a non-rebreather mask, do you know what the masks have to have on? They have to have those little valves on the sides. When you wear the mask, it's got like the little cutout sides. It has like little one-way valves that cover it up. And then basically when you exhale, the valves are supposed to open, and then when you inhale, it closes. But if you have a lot of CO2 in that mask, when you breathe back in, you will re-inhale your CO2. So any mask almost really, as long as it's got little holes that are covered up, you will re-inhale some CO2. So rebreathing masks if you can. Assess the mental status, because if they about breathe so fast that they're going to pass out, keep an eye on them, keep them safe. But really, we need to get them to slow down their breathing. The culprit is respiratory. They're probably hyperventilating somehow, some way. Figure out what's causing it and make it stop. Metabolic is something's going on in the body. Something's going on in the body. Most likely, they either puked too much, pooped too much, got it NG suctioned out. We lost all of our bicarb and our positive ions. Like we lost all of our electrolytes. We lost all of our bicarb. It either got pooped out, peed out. Most of our metabolic causes are too much vomiting, too much suctioning. We peed out too much. We pooped out too much. You can put diarrhea on there as well. Diarrhea can cause acidosis metabolically. It can cause alkalosis. Depends on what you're pooping out. If you poop out your bicarb, you're alkalotic. If you poop out just ions, you're acidotic. So it just really depends. You can also make yourself alkalotic by taking sodium bicarb. Why would you take sodium bicarb? Stomach indigestion, Tums, it feels really good, coat your stomach, but it's bicarb. So if you are eating Tums by the can, which some people do, you will have an increased bicarb level. You will be metabolically alkalotic because you just put too much bicarb into your system. You ate it. Steroid use, it's there. I don't know why. I'd have to think about it, but it's there. It increases your bicarbonate somehow. So what are your lungs going to do? What do you think your lungs are going to do? You are alkalotic. What have you lost? You've lost acids, or you've got too much CO2 hanging out. You've got too much bicarb hanging out. You either ingested too much bicarb, or it didn't get pooped out or whatever. You got too much bicarb in your system. So your lungs are going to want to retain some acids. So your respiratory may drop. Okay? It's not because there's something wrong with your respirations. So that's why sometimes we don't know. That's why we draw the ABG. If it was 100% clear what was going on, we wouldn't draw the ABG. So maybe the patient is hypoventilating. And we're like, well, we don't really see anything. The lung sounds okay. I'm not really sure why they're hypoventilating. They haven't had any O2 in a while. I mean, they haven't had sedatives in a while. I don't know. Let's draw an ABG. Because then we get an answer. And it points us to the right cause, and then we can treat the cause. If it is respiratory, you're going to do respiratory interventions. If it's metabolic, you've got to figure out the cause. That's the only way to fix it. So in metabolic alkalosis, your pH is high or low? High. It's an alkalotic pH. Your bicarb, this is the root of the problem. Your bicarb is going to be high as well. And then if your lungs are compensating, your CO2 may change. Okay, so, and then your interventions are going to be monitor your patient and try to figure out the problem. So you're going to be doing a lot of research. Metabolic problem, nobody wants to get the metabolic on the ABG because they're like, dang it. Now we got to do a lot of work and figure it out. We got to draw more labs. We got to figure out what's going on. Because metabolic means there's a disease process that is causing a problem. And this is where, so what are the issues that we think about? One of the things that we can do is because a lot of the problems, if your patient has an NG tube and they come back metabolically acidotic, what do you think we're going to do with that NG tube? We can control how much that's putting out. So we just pause it or stop it. If your patient's putting out 4 liters out of the NG tube and they're starting to feel dizzy and lightheaded and numbness and tingling, what are you thinking? Their patient's numb, tingling, dizzy, lightheaded. Their oxygen levels are okay. They have an NG tube that put out 3 liters. What are you thinking in your head? Dizzy, numb, tingling. What are you thinking? Acidosis or alkalosis? Alkalosis. Acidosis made you feel headachy and pain and achy and feeling. This one makes you dizzy, lightheaded, tingly. So this patient is complaining of dizziness, numbness of their face. You could draw a calcium level because guess what? Numbness and tingling was calcium too, right? Hypocalcemia. But you have an NG tube. Your brain's like, what happens during NG tubes? We lose a lot of our acids and bicarb, or we lose a lot of our acids out of there. The bicarbs don't get pooped out or whatever, or they got an NG tube. You think to yourself, NG, suctioning, body. If you have any kind of reason to think that they've lost a lot of ions, maybe you gave them a diuretic. They're numbness, they're tingling, they're woozy, they're not feeling that good, and you gave them a diuretic. What do you think you're going to watch? What are you going to get? Doesn't matter whether it's acidosis or an electrolyte, you're going to get labs, right? I want you to think about your patient. My questions will ask you about your patient. I don't care how many lists you memorize. I care about that you can take care of a patient. So my patients are going to be, their questions are going to be patient-based. They're going to say, your patient looks like this. They have this. What do you want to do? And I want you to think, well, if they have an NG tube and they just put out a ton of pee and their numbness and tingling around their lips, they either have a calcium problem or a electrolyte problem. Then you go to your answers and it's an ABG question. Well, I guess you know where you're going. You're probably headed to the metabolic alkalosis. You get your ABG and it will confirm that. But you're going to have your patient will be in front of you, and I want you to take care of the patient. So one of the metabolic causes of alkalosis are going to be peeing out too much, pooping out too much, or NG out too much. Or maybe taking too much bicarb. Maybe you might want to ask the patient, hey, taking a lot of Tums lately? When your ABG shows metabolic alkalosis, you got to look around for a cause, and those causes are going to be too much excretion or too much bicarb, really. Okay, so talk to your patient, figure out what's going on, because nothing's going to get better until you stop the cause. So if they have a huge amount of NG tube output, you got to stop the NG. If they're having a huge amount of diarrhea or vomiting, what do you got to do? Give them something for diarrhea or vomiting, or get it. If they are taking too much Tums, what are you going to do? Tell them stop taking Tums. We just want you to take care of patients. If they were metabolic acidosis, what would that be from? What was metabolic acidosis?
CO2.
Well, too much acids in your bloodstream, a body problem, an illness. What are you going to look for? Kidney problems, diabetes problems, any other electrolyte problems. You bet you're going to be drawing a lot of labs because you got to figure out what's going on with the patient. Metabolic's a little easier because it's usually you can see it or you can decide what it is. Metabolic acidosis is the hardest one to figure out. So let's talk about reading them. Let's talk about a couple of methods for reading them. There are 3 that I am going to show you. So the first one's kind of on here. I don't really like this one because it doesn't give you all of it. The first step in all the things I'm going to say, let's take a break. And then we'll spend the last hour going over this. So, all right, because the recording only shows what's on the iPad here, the board won't show. So I'm going to do them separately, and then we'll kind of do using all 3. I'm not a big fan of this one, but if you've learned it and like it, and I'm going to say, how many of you feel like they got ABGs? If you feel like you got ABGs, I would recommend you just probably not listen, okay? If you've got ABGs and you can interpret, leave. This is probably extra. If you need it, then we'll give you a couple. Because once you get it, stick with what you've got that makes you get it, okay? Stick with it because I'm not going to teach you anything I'm just giving you a couple of different ways to do it. But the important part is that you get it. All right, so with all 3 of these, I'm going to show you 3. One's called the Rome, which I'm not a big fan of. One's called a tic-tac-toe, and one's called a 3 or 4 step. The 3 and 4 step and the tic-tac-toe are almost exactly the same. It's just the way you set them up is a little bit different. But the first step in all 3 of them is to look at an ABG. So I'm going to do a ABG, the same ABG, with all 3 of these, and I'm going to demonstrate them on the big thing. And then what we're going to do, we're going to go to ABG Ninja and have you guys call them out, and we're just going to do them over and over again on each of the 3. And I want you to pick one that you like and go with it, okay? So let me grab this. All right, let's pick an ABG. So somebody go to ABG Ninja, who has a computer. And,
I have it.
You have one? All right, give me an ABG.
pH 7.47,
Okay.
CO2 49, bicarb 34.
34. Okay. So here we are at 747, 49, and 34. I'm going to do this one, all 3, on the computer here so that you can see them. All right. First step on all of them is look at the pH and name the pH. Alkalosis. So on this one, you have to kind of write on here. You've got pH alkalosis. Oh, can't go away. I don't even know what this is from. Go away. All right. So on this one, you write down your pH. So we're going to go over here. Let me make this nice and dark and big. On this one over here, we're going to write our pH, 7.47. So it's alkalosis. Alkalosis. Great. We named it. Now we're going to see which one is the opposite. So we have 749. That one, is it up or down from normal? Up. So we're going to look and see which one the CO2 is. This one only looks at the respiratory first. So we're going to look at the CO2. What is the 49? Is that up or down? CO2 of 49 is up. It's not respiratory because respiratory is opposite. Okay, so if you like arrows, this one's for you. What's the bicarb? Is it up or down? the bicarb is up. So, this one, you just draw your arrows and you decide up and down. So this one's up, and this one's up. Respiratory is opposite, metabolic is equal. So which one do you have? Your pH is up. Metabolic is equal. If it was respiratory, it would be opposite. So it is metabolic alkalosis. So metabolic is equal, so this one is metabolic alkalosis. Done. Described. You named it. You did it. It doesn't tell you much about the compensation, though, unless you know how. That if something is compensating, what's the other one going to do? Go the opposite way. So it's either normal or opposite. I'm not a big fan of this one because it really just names it the basic name. But it'll be great for you for this test. If you like arrows, it works. Metabolic is equal. Respiratory is opposite. Let's do it another way. Same ABG. So we're going to go to a new screen. Oop, let's get rid of all this. All right, so let's do our pH 747. Let's do it tic-tac-toe. So if you're going to do it tic-tac-toe, you're going to make a tic-tac-toe. Except the first one, you're going to write acid on one side, normal here, and alkalosis here. And you look at your ABGs and you decide, 747, which one is it? So the first one we name is the pH. So pH, where does it go? Is it acid, normal, or alkaline?
Alkaline.
Alkaline, so our pH fits here. All right, where does our CO2 fit? Acid, normal, or alkaline?
Acid.
It's acid, so we've got CO2. Where is our bicarb? Acid, normal, or alkaline?
Alkaline.
It is alkaline. So we have, bicarb. Or you can write bicarb, or you can write HCO3. They're the same thing. If I can write HCO3. Which one is in the same row as your pH? Bicarb. It is metabolic alkalosis. But this one can go the extra step and say, is your CO2 normal? Heck no. So it's being compensated. It's trying. It's trying, okay? But it's not all the way, because what would a fully compensated gas have? A normal pH. So it's trying. So this one, we named it metabolic. Same idea. Metabolic, because it's in the same line as your pH. It's whichever one's in the same line as your pH.
So the HCO3s are metabolic.
HCO3s are always metabolic.
And the
CO2s are always respiratory. Yes. Sorry, we need to make that clear. HCO3 is metabolic. Bicarb, metabolic. CO2 is acidic and it is respiratory. Okay? So the pH lines up with the bicarb. So it has been named alkalosis and it has been named metabolic. We named it alkalosis because they both are under the alkaline side. And the one that lined up there is the bicarb, so that's what we have named it. Oh, go away. Why are you doing this to me? Go back to the regular screen. Oh, my God. Oh, it got rid of my little screen. All right, so that one's clear like mud, right? Okay. This is tic-tac-toe, so we're going to just draw it. So let's see, acid, normal, alkaline. So with this one, you just have columns. You have to take a look at your pH. and know which way, you're gonna have to figure out these numbers. You have 7449. You need to figure out which box it goes in. So you have to know, is it high or is it low? All right. It's 735 to 745, right? What's 749? High. It's alkalosis. It doesn't help you where to put it. But once you figured it out, you put it there. So we've named it alkalosis. Now we got to figure out the cause. So we look at our CO2 as 49. Is that acidic or alkaline? It's acidic, so it goes in the acidic column. Or you could write respiratory. You can write whatever you want. The CO2 is the number here. We're putting it just in categories. The pH is alkaline. The respiratory CO2 is acidic. All right, so now we're going to look at the bicarb. And that is 34, which is on the acidic or the alkaline side. It is on the alkaline side, the CO2 bicarb of 34. So this bicarb of 34 goes in the alkaline box. So our bicarb metabolic is lined up with our pH, so it is metabolic alkalosis. So we've named it the same way we named it with the arrows. It's metabolic alkalosis. This one gives you a little bit of a visual as to what the compensation side is doing. Okay? So we have metabolic alkalosis. We know that that pH is not normal. So we can't name it compensated. The pH is not normal. It's uncompensated. But it's either uncompensated, meaning nothing's fixed yet, but it's trying, or it's completely not even paying attention, completely uncompensated. Okay? So let's just keep trying it, because I swear it will click. And this is why I'm not really having you do compensation right now. But on this one, the CO2 is out of whack. So something is going on. So it's trying to compensate. So there is some compensation going on. And it's not compensated yet, so it's partial. Partially compensated metabolic alkalosis. So that's the tic-tac-toe. We'll keep doing it. Let's do the other one. And this one's mine, so it's my favorite. So this one you set up with your numbers on it. Or I like it that you can write your numbers on it. So we're going to take the same ABG. So we start with our pH. And I'm just going to write the numbers right there. 735 to 745. And I like this one because you can set it up and then use it for the entire test or use it for your entire life. You can just set it up somewhere. And it's done, which is why I love it. Your CO2. A lot, and I will tell you this trick when you're setting it up. And if you want to set it up and use it as a template, works great. Set it up backwards. Because remember, when that CO2 is high, you're acidic, right? So what we're going to do is we're going to kind of be like these tic-tac-toe where we have acid and alkalotic here. But I'm going to write my numbers right there like this. So I have my range, but I know that if my CO2 is 20-something, it's going to go on the alkaline side. It sets it up in my brain. I'm a visual person. Sets it up visually for me. So if my CO2 is high, it's going to go to the acid side. I just kind of flip it there. I know, right? Okay. And then we have bicarb, HCO3, 22 to 26 is what we decided on. So, hey, you got a template right there. Works every time. You just plug in your numbers. So, isn't it amazing, right? Okay. So, pH 747. Oh, look, 745. We're going to put pH right there. All right. What's our CO2 is 49, so we can write our gas right here. Oh, God.
Oh my God.
Dang it. Sorry.
Have you restarted your computer recently?
I have probably not enough.
Have you updated your web?
Let me just do this. I wanted to record it, but I think what we're going to do because I want to do these, but for some reason it just gets rid of my. Let me see if I can get how this go back to the screen. I figured it out. Okay. So we have a CO2 of 49. So here we have our, let me just write our gas down here so you can see it for posterity. We had 7.47. We had a CO2 of 49. And we had a bicarb of 34. This is what came off of ABG Ninja. All right, so we have 745. We want to put it in the alkaline side. The CO2 of 49, which side does it go to? Acid. And then we had the bicarb of 34 goes to the alkaline side. And so the first thing we did is we named the pH. So the first, and I like to call them the first name, the middle name, and the last name. So what is our last name? Our last name we do first. Our last name is alkalosis, right? Our middle name is what we're going to go next. Which column matches? This is metabolic. So you can get used to writing bicarb and metabolic together and CO2 and respiratory together. So we have a metabolic alkalosis. Okay, we've got a metabolic alkalosis. We're good. We matched up that line and it works. Okay, metabolic alkalosis. So now for the compensation, we have to figure out, so the first name is whether it's compensated or not, okay? If our pH was in the normal range, it would either be, you have two first names. So I'm gonna put this over here. So let me just write this here so you can have it for posterity and then we'll keep practicing it. So the first step is you figure out your last name. And that's your pH. The second step is to figure out your middle name. And that's your cause. The third step is to figure out the first name. Your last name, here, I'm gonna see if I can make this cleaner. For the last name of your pH, you get two choices for your last name. What are your two choices? Acidosis or alkalosis. Those are your two last names. You only get two. Your first name, you have two choices for your first name. You have respiratory or you have metabolic. For your first name, you get a couple of choices. You get, let's talk about your first name being normal or compensated. So you have two choices there, and then you have uncompensated or partially. So you have four first names you can have. So you can only have two last names, you can only have two middle names, but you can have four first names. The first names, well, first name you can totally be normal. That's the whole thing is normal. Your first name, middle name, and last name are all normal. Then you're normal. So I guess you could have a last name of normal and a middle name of normal, but you're not going to call it normal, normal, normal. It's just normal. If your pH is normal, it's either two things. Everything's normal, or you're compensated. So this one is a pH of 7.35 to 7.45. We don't even really, if your pH is normal, we don't name it. It's just normal. But we got to keep a look. And because if your pH is normal, it could be everything else is out of whack. We'll keep doing this. So your two first names could be completely normal or compensated. If your pH is in the normal range, you are either have a normal ABG or a compensated ABG. Fully compensated, completely compensated, compensated. If your pH is anywhere outside of 7.35, 7.45, your first name is either going to be uncompensated or partially compensated. Okay? So there aren't that many choices. Let's just keep going through it. Okay? It's written in the chicken scratch. I'll try and make it a little bit better. Because if your pH is normal, you don't get to just stop. You have to still look and make sure that the other two are okay. Wait, I think I figured out how to do this. There it is, it's back in its bad sense. So if your pH is normal, 735 to 745, just before you leave it and say everything's great, just take a look at your CO2 and your bicarb. If they're within normal ranges, well, you can leave it. It's done, it's normal. If they're not, then you file away, this must be compensated. And you can write compensated, and then you go through your whole rest of your diagnosis stuff. So let's pull up ABG Ninja. If you liked this one, I'll do a couple of them, all three. But let's get a new one. And let's do them all three. So pull up another ABG Ninja and give me a guess. Anyone? Next?
Oh, you want another one?
Yeah, let's give me another one.
7.47 pH.
Get another one. We already had a 7.47 pH.
7.27.
All right, 7.27.
CO2 of 51.
Okay,
And then HCO3 of 23.
23. All right. So let's start with Rome. If we're going to do this Rome, your pH is 727. Up or down? So for whatever way, I'm going to say you're going to have to write these down somewhere for yourself. Okay? So just make yourself a little guide that you write down on your test. That's why I'm like, the template works, because you got your guide right there. But let's go ahead and write our pH is 735 to 745. Ew, back. What's our CO2? You want to do 45 to 35? You want to make it backwards? 45 to 35. All right, and we are going to do our bicarb as what? 22 to 26. Okay, so our pH of 727, what are we? Up or down? We're down. What is our CO2? What is our bicarb? All right. Wait, what? Which one is it? Is respiratory's opposite? It's opposite. It's a respiratory problem. It's respiratory. What would the metabolic, if it was a metabolic problem, what would the metabolic be? It would be down. The bicarb would be down. But this is a opposite problem. It's opposite from the pH, so it's a respiratory problem. What do we got to call it? Is it acidosis or alkalosis? What's our pH? It's respiratory acidosis. We named it. Yay. Now, if you wanted to think about compensation with this one, has the bicarb started doing anything? Nope. Uncompensated. Okay, let's do it the tic-tac-toe way. We've got acid, we got normal, and we got alkali. All right, where does our pH go? Where does our pH of 727 go? Goes in the acid column. Where does our CO2 of 51 go? In the acid column. Yep, and where does our alkaline go? 23 is in the normal column. So we've got that bicarb there. So it's lined up in the acid column, so we've got a respiratory acidosis. And then if we wanted to look at the compensation, things are all normal. So it is either a normal ABG, which it's not, or it's compensated, right? Oh, wait. It's uncompensated, because if it was compensated, the bicarb would be abnormal. Sorry, getting me sick. So it's uncompensated. All right, that's that one. Let's go to mine. And we're going to come over here, and we're going to put it in a template. Let's write our little template here. CO2, 45 to 35. And HCO3. And if you wanted to write on your template, go away. Well, at least I figured out how to fix it. Okay. Bicarbs 22 to 26. Oops. So if you can create this template, this will help, right? All right, so let's look at let's put it in our template here. Our pH was 727. Where does it go? Where does our CO2 go? A 57. It goes on this acid side. And where does our metabolic go? It goes here on the normal side. So there's kind of a normal at the bottom here. All right, so what's its first name? We're going to go with its last name first. Last name is acidosis. So here, actually, let me go back and let's write. It's got 3 names. So its last name is acidosis. All right, how do we figure out its first name? Which one matches it? The CO2 respiratory, so respiratory. And now we're going to look at its first name. Was it a normal pH? No, so we can't call it normal or compensated, so we've got to name it partial or un. So which one is it? Partial or un? Un, because there's a thing in the normal column. It's uncompensated. The other one would be out of whack if it was compensating. It's not. So it's uncompensated metabolic acidosis. Yes? Uncompensated means nothing's happening. Partially means that it's out of whack. So so remember, you only had the 4 first names. Let me write these over here so that you can kind of.
But wouldn't compensated mean it's already out of the normal range?
Compensated means that the pH is normal. So let me write this again. Let's write the rules down, and you know what? I'm going to make this on a slide so that you can keep it. Let me go back. Let's write the rules down. Okay.
Yep, compensated pH.
All right. We're going to write rules. So last name is either acidosis or alkalosis. Your first name, or your middle name, is your cause, and it's either respiratory I'll fix this slide up for you. Or metabolic. Which value goes with respiratory?
CO2.
CO2.
CO2. Which value goes with metabolic?
My part,
This is really all you need to get. Okay?
So if you're looking at your table, you notice that you have all the same terms.
No.
You can, I guess it's not easy, you can just figure out the name.
First name can be.
That last part.
Yeah. So we'll keep practicing, but I'm going to write this down now while we're doing it. The first name is the hard part. That's the hard one to figure out. The first one depends on your pH again. So if you have 735 to 745, you have two choices of names. Your name can either be normal, or your name can be, I'm going to have to put this in a grid.
Should do one of those arrow diagrams. Is this yes, no?
Yeah, I know. I'll have to come up with something. I'll come up with my own and I'll copyright it and become rich. If it's not in range, your two name choices are uncompensated or partially compensated. Okay. So, your last name depends on your pH. If you are anything above 7.4, you are alkalosis. Okay, so this is where we're going to, so really the first one, you're just looking at 7.4. This one is anything less than 7.4. So let's leave this one up on the screen, and then we're going to put right next to it, let's put a little table with our template. You know what, I'm just going to go with my favorite. If you like the other ones, go with them. But I'm going to give you my template because this is what works for me. All right, let me find the table. And then it won't get rid of it. Sorry, I'm just creating right here in front of you. You have a pH. You have a CO2. CO2 is respiratory. And what is our range? Right, our 22. That's the first one. Alright, so we're going to leave this up here as a little reference guide. And let's do a couple. Alright, so somebody give me another ABG Ninja. Alright guys, if you want to work on it on your own, by all means, you may go out to a table or anything, but we're going to do just a couple of them over and over and over again. We're going to leave this one up here as a reference guide. slide. So let's go through a couple of these. Give me a pH. Give me one. Let's do it.
7.39.
7.39. CO2.
50.
CO2 50. Bicarb
29.
29. All right, so let's look at our template over there. Is it acid or alkaline? It's 739.
It's still.
Okay, it's normal. Is our CO2 and bicarb normal? No. Okay, then we're not normal. Skip normal. It's not fully compensated either. Well, maybe it is. Don't we have only 2 first names when the pH was in range? It's not normal. So hey, guess what? It's compensated. It's fully compensated. You got a first name. So we're going to write, we found the first name right away. Fully compensated. But we still haven't figured out the middle and the last name. So, pH 739. Which side is it on? Is it less than 7.4 or greater than 7.4? It's on the acid side. All right? Because it's less than 7.4. All right. Where's our CO2? Our CO2, 45 to 35. Is it on this side or this side? It's on the acid side. This is the acid side. All right. So here's our CO2. Where's our bicarb? Okay, so this is our bicarb. So we figured out its first name because the pH is normal. The pH was normal. It's either normal or fully compensated. So the pH is normal because it only had 2 first name choices. So it is fully compensated. But what's its last name?
It's opposite.
What's our last name? Acidosis. What's our middle name? Respiratory. Somebody want to put it in and see if we're right?
I have a question.
Yeah.
If the pH was 7.4, could you just not determine if it would be?
It would be which one's more out of whack,
Okay.
and it would be the CO2's more out of whack.
Okay.
Yeah, normally I don't know if I've seen one where the pH is right at 7.4 because something's out of whack, so it's trying to get back in, and it's going to have a hard time getting right back to the mid-range. But this one would be fully compensated respiratory acidosis. All right. What was your root cause of it? What's the problem? Respiratory. So if you looked at your patient, what do you think your patients had?
Too much CO2.
Too much CO2. What could it be? This is the picture of a healthy COPD patient. Healthy COPD patients live in fully compensated respiratory acidosis. They live with a high CO2 because they can't exhale CO2, so the body gets used to it and it compensates. The problem we have with COPD is that they decompensate very quickly. They're only on the borderline. They retain any more CO2, what's going to happen? They're going to fall out of this fully compensated into respiratory acidosis. And that's what happens to them all the time. They live on the borderline and they fall out very easily. But this is a COPD patient. That's what they look like. Yes. They'll never be normal.
For the test, you're gonna have to figure out where it belongs, first name wise.
No.
No.
First name, not for this test. But next block you will. So if you can get it, great. If not, I don't care whatever method you use, as long as you can get the name right. So when you're going through ABG Ninja, you can even just guess on the compensation or do your best guess. But as long as you get respiratory acid, because my goal for you this block is that you can figure out the cause and be able to look at your patient and make a solution or come up with a solution, okay? So the ABG really gives you another clue. Maybe your patient looks like they're breathing okay, but their oxygenation's not that good. And then you look at them and they got a big barrel chest and you're like, COPD. All right, let's do another. Now you may go if you like, because this is what we're just going to practice, okay? So if you feel like you got it and you're good and you just want to practice at home, go to town. For those of you that want more, give me another one.
Do you mind explaining
No, not at all.
the fully compensated versus partially compensated, like somewhere
So
on there?
partially compensated means that the body has recognized that there's a problem and started the other side to try to fix it. Okay? So if it's a metabolic problem, what's compensating for a metabolic problem? Respiratory, your lungs. So that means the lungs have seen there's a problem and started trying to fix it, meaning it's throwing its CO2 out of whack. If the lungs have not seen it or tried to fix it, it's not throwing the CO2 out of whack. So in order to fix a problem, the other one's got to go out of whack to compensate.
But the pH.
The pH determines whether that's actually happened or not. So the pH, if it's normal, you either had a normal ABG or the compensation has worked. Okay? If you're uncompensated, you either haven't started fixing the problem yet or you're in the middle of fixing the problem. The pH is out of whack. If the pH is in whack and everything's normal, then you're normal. If your pH is in range and everything is messed up, then you're fully compensated. Because everything's going to be messed up to fix that problem. Okay? Does anybody else want to do more? Or are you good?
Can we do respiratory alkalosis?
Sure. Let's do a respiratory alkalosis. Let me come up with the name. Okay. Here's one. Now you know what it is. But let's look at it. Is the pH normal?
No.
Nope. So we're going to get rid of those other choices and names. So your first name is either uncompensated or partial. We don't know yet. So let's go through our last name first. What's our last name? Our last name is alkalosis. What's our middle name? Let's look at our pH and our bicarb to figure out the middle name. What's our CO2? Which side is that on? And what side is this on? It's normal. So we have a normal under here. Okay. So our middle name is whatever matches the pH. So our middle name is alkalosis, or respiratory. The CO2 is respiratory. So that's why I would recommend kind of setting up your little grid with the values and what it is. So you'll know whichever one matches the pH, that's your respiratory. So we have respiratory. So we have a respiratory alkalosis. You could be done right there. You got to go look at your patient and figure out what's going on. But what do you think is going on in a respiratory alkalosis? What are they getting rid of? How do they do that? They're hyperventilating. So, yeah, no, we haven't even, we're just, if you stopped right there, you could go take care of your patient with just this. You don't need to know the compensation. The compensation will tell you how long it's been going on. All right? If it's been going on, if it just started, the body hasn't had time to compensate.
So it's uncompensated.
This is uncompensated. It's either uncompensated or partially compensated. How do we know? So we know that it's not in range, so it only has two first name choices. Uncompensated, partially compensated. If it is uncompensated, has the body realized there's a problem and started sending the other one out of whack? No. And that's exactly what we have. We have a normal CO2, so it is uncompensated.
So if it wasn't normal, then
If the bicarb wasn't normal, then it would be partially compensated, meaning the bicarb's getting up to try and fix it, but it hasn't quite gotten there yet. Let's do another one. Give me another one. You've got this. You know how to take care of these patients. You know this. You just don't know you know this yet. Let's do one of the ones. Let's do one of the ones that's on here. All right. Mr. Coughing, respiratory distress, COPD, green sputum. You probably know where you're headed with this, but let's double check. pH is 726. Let me set up the template over here since I got rid of your template. And this one is respiratory, and this one is metabolic. All right. So where is your pH? Which side? Acid. Where is our CO2? Acid. And where is our bicarb? It's 22, 26, so we're alkaline. All you have to do once you set up your template is just see which side it falls on, and you know which way it goes. Okay? So, nothing's normal. We don't have to worry about that. So what's our interpretation? So let's just work backwards. What's your last name? What's the cause? And so is our pH normal? No. So what are the two choices of names? Uncompensated or partially compensated. So, has the other side started moving? Yes, partially compensated. All right, so what is your interpretation? He's respiratory acidosis. Is he compensated? Partially. What do? That's the hard part. Yeah, I'm hoping that helps. Yeah. Just keep working it until you get it. So what's the hang up? What's the problem?
The compensated part, the first part. How did you get that? I'm so confused.
Because look at this bicarb. So we figured out the culprit.
Yeah.
So we're going to look at the other system. Is the other system okay?
34, no.
No. So it's partially compensated. If the other system was okay, then it didn't recognize that there's anything wrong yet, and it's not trying to fix anything. So it's uncompensated. It's not compensating.
So if it was under normal...
If it was under normal, it would be uncompensated.
Okay, now I
Yeah.
get
We'll just have to keep doing it until it clicks. It's just practice. I've looked at them for 20 years, so yeah, I can do it. But you're just looking at it fresh and new. All right. So what do? That's the hard part.
So it's respiratory.
It's
so
respiratory. You're going to do respiratory stuff. Okay? So it's respiratory acidosis. What's the problem?
Letting too much. He's holding on.
He's holding on to too much CO2. He can't get the CO2 out. So what do you think you're going to do for Mr. Coughing, who's got a lot of green sputum?
Tell him to do deep breathing.
Cough, deep breathing. Maybe he needs to suction. Maybe you can pat on his back and clear his secretions.
I'm gonna pass this test.
Yeah. So
Just make sure those are the answers we have, and I'll just answer them every time. Give him a nice back, the pat on the back. I got my answer.
If it's respiratory, I bet your answers are going to be something respiratory. I bet. If it's metabolic. Let's go through and see a couple more. So then you don't have to change. You just have to erase your corners here. You leave everything else exactly the same on your template. Okay, that's why I like the template. I used to have it on my clipboard, and I would just pencil in my values, and I had it right there. I'm like, I guess you can learn other ones, but this one works. All right. Eddie is in the hospital, post-laparoscopic chole. His pain is at an 8. He's got a history of sleep apnea. Let's look at our ABG. Is our pH normal? No. Nope. All right, we got to do it with something. All right, which way is it going to go?
Acidic.
It's acidic. So here's our pH. And all you have to do with this template is just once you write it out, so when you go to a test, if you can memorize this, all you have to do is write it out. You can do your test, okay? You keep it on a clipboard at school or work or wherever. It's on this side, so it goes over here. CO2, which side does it go on? All right. Look at look at that PO2. Wait, we don't normally look at the PO2. Oh my God, I better stop doing an ABG and go take care of my patient. No, all right. So we got oxygen on him. Oh, all right. Bicarb, where are we on the bicarb? All right, so it's Last name.
Acidosis.
What's its middle name? And what's its, so now we've got to look at its name. So the pH was out of whack, so we're either or partially. Uncompensated. Uncompensated respiratory acidosis. That means it's probably just started. If it's uncompensated. Or the other side doesn't work. But it probably just started. If it's been going on for a long time, the other part probably would kick in and start compensating. So this means it probably just happened, this respiratory acidosis. What's the problem?
It's not realizing something's wrong.
Yeah.
Well, it's not realizing something's wrong. So it's probably just a new process, something going on. But what's the culprit?
Lung.
Lungs.
Oh.
The culprit is lungs. The middle name is the cause of the problem. So if respiratory is the cause of the problem, what do you think is going on? What's happening to him? Hypoventilation? Hyperventilation. He's blowing off too much CO2. Look at his CO2 level.
History of possible sleep apnea.
No, wait.
No, wait, he's holding on to
Yeah,
CO2.
he's holding on.
He's holding on to CO2.
Hypo.
You're right. You're right. Hypoventilation.
Yeah.
So he's holding on to CO2. Thank you. I didn't even look at my numbers.
Is that
So
maybe the
he's holding on to CO2. Why would he be holding on to CO2?
maybe sleep
Sleep
apnea?
apnea.
Possibly sleep apnea. We got to go look at our patient.
Maybe
It's going to be respiratory, but he's holding on to CO2. So he could be like,
Pain.
breathe.
Pain on the lung.
He may be breathing, but maybe he's not breathing well. Go look at him. Your treatment plan is to go look at your patient. Treat his pain, unless his respiratory rate is way low. What if you go in to look at your patient and his respiratory rate is 12 or 10? Well, maybe he got too much sedation. I can't give you the answers to those questions. You're going to have to go look at your patient. But the problem is respiratory, and the problem is he's holding on to too much CO2. So he's underventilating, either because he's in pain and taking teeny tiny little breaths and not breathing deeply, or he's knocked out in there.
So I guess kind of off topic, on topic. So I guess what you're saying is like when you're in the hospital and you got your labs and you look at the ABGs, you would actually physically write out and whatnot, or no? You kind of look and recognize.
What do you
And
mean?
then,
Like, do
if
you
Yeah,
write this
when
out?
your values are all out of whack.
I usually only look at it to see what my cause is. I don't care if it's compensated or honestly, 100%, I don't care. I just want to see, is my cause respiratory or is it metabolic? I need to know where to go look. All right? Because if it's metabolic, I got to look at more labs and look at some other stuff going on in the body. If it's respiratory, I better go in and see my patient. Something is going on with him that's making him respiratory, underbreathe or overbreathe. I got to go fix my patient.
So you would want to know your compensation if it's been like days.
Yeah.
It's been an issue.
I mean, yeah, if something is new and uncompensated, well, I better get my booty in there and try and see what's going on. If it's been days, then they've been in it a long time. It doesn't really make any difference in what my interventions are going to be, but it just gives you a little idea. So it's not that important to me whether you know how to do it or not. But anyway, let's do this one. See how you got this? You're like, this is guaranteed points now. Okay. NG2, post, you're like, NG2, I know where we're going. All right. What is our pH?
Alcoholic.
What is our CO2?
Normal.
What is our bicarb? Is our PO2 okay? If 85 is good for us, I don't know. I can look at the stats and see. But all right, so let's name it. We got some time to name it. Nobody's in crisis right now.
Alcoholic.
What's the cause?
Metabolic.
You can stop right there if you want, but what's its first name? Is the pH normal? So it is either uncompensated or partially, and this one is, no, this one is uncompensated. Because you have an error in the normal side.
I have 85.
If the CO2 was over here, then it would be partially compensated, but here it's uncompensated. The CO2 hasn't started moving, so we have a metabolic alkalosis that's probably pretty new. The CO2 hasn't tried to do anything or can't do anything about it. So anyway, we're uncompensated metabolic alkalosis. So what do we have to do? What's the problem in the alkalosis? What's making us alkalotic?
Loss of acids.
Loss of acids. Where in the world would we be losing acids from in this scenario?
And
GI tract or suctioning
The
out.
GI tract, you're suctioning it out. The NG is draining more than 500 milliliters.
Vomiting too, right?
Could be vomiting because she had an appendectomy. Maybe they're dehydrated. The IV was infiltrated last night, so IV fluids. They could be dehydrated. They're dehydrated and lost acids because we're seriously dehydrating this patient. So what do you want to do for this patient?
less suctioning.
Yeah, maybe we could pause that suction for a little bit. Maybe we can notify the physician that there's that much suction. We would probably want to get her rehydrated because she's lost a lot. Maybe we could replace some electrolytes. Maybe LR was her fluid. Maybe that would help. It's got some ions in it. So maybe we can help her out a little bit by giving her some fluids and slowing down that NG drainage. Okay? Because you figured, hey, those would be some causes right there. So we could intervene. Okay? And you're certainly not going to stop the NG tube drainage and then never let anybody know, but you could certainly call a doc and say, hey, my patient was metabolically alkalotic, her NG put out a lot, I paused it, what do you want to do? Because really, metabolic's going to require a consult or somebody to talk to. You're not going to be able to solve this problem immediately. It's a metabolic problem. All right. Are we done?
Yeah.
We got a couple that are just practice, like you can do. What about this one? I like these too, even though you don't have to interpret anything, you still got to think about it.
Respiratory, so it's hyperventilation, respiratory acidosis, or,
Alkalosis, because if it was acidosis, you'd be holding on to that, so you have a lower respiratory.
Correct. So respiratory rate of 38 is probably going to be blowing it off.